Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, my name is Muhamad Atarigsyah, and today I would like to present to you about drug. This presentation will be used as the assignment for my final exam for Speaking for Formal Setting class, taught by Mem Yanti Ismiati. Okay, let's get started. Drug, broadly defined, is a term used for any chemical substance that, when introduced to the body of a living organism, has a non-food impact in altering the organism's normal functioning or structure. The term drug lacks a precise definition and may be used in different senses in medicine, pharmacology, government regulation, and common usage. The term may have a positive connotation as a chemical compound used medically in humans or animals for diagnosis, treatment, cure, mitigation, or prevention of disease, pain, or other abnormal condition. It also may have a negative connotation as a substance that affects the body or mind of humans in such a way that it implies impairment, abuse, addiction, or illegal use. Some drugs are used to create or enhance recreational experience, also called as recreational drugs, and some are used in religious, shamanic, or spiritual contexts. Human creativity, interacting with the natural environment, has been able to identify, produce, and synthesize many drugs of medical significance, such as aspirin and quinine and penicillin. However, many drugs have been tied to abuse, resulting in physical, social, and psychological harm, and the illegal drug trade has been linked to violent crime and other societal harms. The World Health Organization notes that drug is a term of varied usage and that 1. In medicine, it refers to any substance with the potential to prevent or cure disease or enhance physical or mental welfare. 2. In pharmacology, to any chemical agent that alters the biochemical psychological processes of tissues or organisms. And 3. In common usage, the term often refers specifically to psychoactive drugs, and often, even more specifically, to illicit drugs, of which there is non-medical use in addition to any medical use. Types of drugs. There are numerous ways in which drugs are grouped. The following are a few of the common groupings. Number 1. Non-steroidal anti-inflammatory drugs, or also called as NAIDs. Number 2. Analgesics. Number 3. Antipyretics. Number 4. Anesthetics. Number 5. Antiviral drugs. Number 6. Antibiotics or antibacterial. Number 7. Antimicrobial drugs. Number 8. Antiseptic drugs. Number 9. Over-the-counter drugs. Number 10. Prescription drugs. 11. Psychoactive drugs or psychotropics. And the last one is recreational drugs. Uses of drugs. Drugs are used mainly for 4 common usage. The first one is medical. A medicine or medication is a drug taken to cure, treat, mitigate, or diagnose an illness or medical condition, or may be used as preventive medicine that has future benefits but does not treat any existing or pre-existing diseases or symptoms. Number 2. Spiritual and religious use. Drugs have been employed for spiritual and religious use since antiquity. Entheogens is the term used for psychoactive substances when they are used for religious or spiritual effects, whether or not in a formal religious or traditional structure. Entheogens are mostly hallucinogens, being either psychedelics or deliriants, but some are also stimulants and sedatives. Number 3. Self-improvement. Nootropics, also commonly referred to as smart drugs, or drugs that are claimed to improve human cognitive abilities. Nootropics are used to improve memory, concentration, thought, mood, and learning, and many other things. Some nootropics are now beginning to be used to treat certain diseases such as attention deficit hyperactivity disorder, Parkinson's disease, and Alzheimer's disease. They are also commonly used to regain brain function lost during aging. Racetams, for example, pyricetam and oxiracetam, are considered to be a class of nootropics. Number 4. Recreational drug use. Recreational drug use is the use of a drug, usually psychoactive, with the intention of creating or enhancing recreational experience. Such use is controversial, however, often being considered to be also drug abuse, and it is often illegal. Also, it may overlap with other uses, such as medicinal, including self-medication, performance enhancement, and entheogenic or spiritual. The drugs most popular for recreational use are caffeine, cannabis, ethanol, tobacco, opiates, opioids, and cocaine. Administering drugs. Drugs, both medicinal and recreational, can be administered in a number of ways. Many drugs can be administered in a variety of ways rather than just one. Number 1 is inhaled, breathed into the lungs, as an aerosol or dry powder. This includes smoking a substance. Number 2, injected as a solution, suspension, or emulsion. Number 3, insufflation or snorted into the nose. Number 4, orally, as a liquid or solid that is absorbed through the intestines. Number 5, rectally, that is absorbed by the rectum or colon. Number 6, sublingually, diffusing into the blood through tissues under the tongue. Number 7, topically, usually as a cream or ointment. And the last one is vaginally, primarily to treat vaginal infections. So in conclusion, drug is a term used for any chemical substance that, when introduced to the body of a living organism, has a non-food impact in altering the organism's normal functioning or structure. Drug has both positive and negative connotations, depending on the context that is used. Drug that has positive connotation is called as medicinal drugs, while drug that has negative connotation is usually called as recreational drugs. Okay, I think that's enough for my presentation about drug. I hope you learned something, and I'm going to close my presentation by saying wassalamualaikum warahmatullahi wabarakatuh.